It's 4 o'clock.
Yes, we can start now. Hello everyone. Welcome to the fifth webinar of this series organized by Healthcrum with Max Hospital. Since we have done plenty of webinars from diverse specialists of Pan India and also supported government during pandemic, today's series will enlighten us about dermatology and the topic is Know Your Skin and Hair Care Basics. Healthcare is the only platform giving end-to-end personalized healthcare assistance. Healthcare is serving individuals and corporates with personalized support and care in 24 states at 900 plus locations. We at Healthcare makes individual and their dear ones free from worry of remembering or collection of health-related stuff, and we talk about ROI of your healthcare expenditure. As Healthcare is focused on quality and healthy life of the individual over the price. In continuation with these, we had collaborated with India's leading hospital, having 2,300 plus leading doctors, offering treatment for 29 specialties with the network of 12 full-fledged hospitals and 5 other medical facilities. And that's none other than Max Healthcare. As the webinars are not one-way process, if you have any queries, you can ask question or raise your hand. You can also watch the live webinar and ask question at Healthcom YouTube channel. And don't forget to like, subscribe Healthcom Facebook and LinkedIn pages as well. Today, I am glad to introduce Dr. Veenu Jindal. She is a consultant dermatologist at Max Hospital. Dr. Jindal is having experience of more than 5 years and she is a MBBS gold medalist. Dr. Jindal is completed MD from BJ Medical College and Civil Hospital, Ahmedabad, and SCE Dermatology from Royal College of Physicians, London. Dr. Jindal has been awarded with Torrent Young Scholar Award, and she also has been part of International Society of Dermatology, Indian Association of Dermatologists, Venerologists, and Leprologists. Hence, I would like to hand over the session to Dr. Veenu Jindal. Handing over
Hi,
to
hi, Gurni. Thank you for the kind words and thank you for having me. And I am really thrilled to discuss the basic of skin and hair care with you all, guys. So, shall I start sharing my screen now?
Yes, ma'am, sure.
Yeah. Yes, I hope I'm visible.
Yes, ma'am.
Okay. So, now we'll be talking about the entire skin and hair care basics, then 101, and your entire complete guide to it. In the past 1 year during the pandemic, we have our world has completely shifted and people have started focusing on their health more, and with a special focus on the skincare and healthcare. So what has happened, what we have noticed is that a lot of people have started going towards DIY home care tips and tricks and have started suffering a lot of skincare conditions which they did not have previously. So it's very important that you know how you take care of your skin, and also that you obtain your knowledge from a reliable source. Do not just rely on what you see on Instagram. Do not fall prey for what you see influencers posting. Also, there is a lot of noise around skincare products coming up. There are numerous amount of skincare products in the market. It's very important that you should know what product works for you and how to choose your skincare product. Now, great skin is not simply a matter of DNA. Your daily habits, in fact, have a big impact on what you see in the mirror. So, the first step in knowing the skincare is to know your skin type. It's more of a subjective feeling, and you, at the end of the day, would know your skin type better. There are two very simple tests which can help you in knowing your skin type. First is test. You wash your face with a mild cleanser. Do not apply any product or makeup. Wait for 30 minutes and then examine how your skin feels. The other test is that you simply take a blotting paper, gently tap it on along your face, hold it against a bright light, and check for oil residues. If your face is not shiny and there's no oily residue on the tissue, you have normal skin. If your face looks or feels tight and there is flaking and there is no oil residue on the tissue paper, then you have dry skin. Oily skin people would generally, the tissue paper would pick up oil all around, and your face will start feeling greasy right after 15 or 20 minutes. In combination skin, the T-zone area is oily. The cheeks can be sensitive, dry, or even normal skin. Now, how does normal skin look like? In normal skin, there is a correct balance of moisture and oils. It's neither too dry nor too oily. The pores appear very, very fine and minimal. And the texture is pretty smooth with no blemishes, no acne, nothing. Dry skin, on the other hand, looks brittle, dull. It can feel tight and sensitive to products. And also, the pores are very, very minimal. Oily skin is right opposite. With excess oil production, the pores are very, very big, they are very prominent, and this skin type people are prone to having acne, whiteheads, blackheads, and probably, a puberty zone full of acne issues. Combination skin, as I already told, is a combination with T zone probably having oily texture and this having a normal to a dry texture. So once you know your skincare type, the next is building a skincare regime. This is a very famous chart which you must have already seen on various social media platforms. What is the stepwise approach to skincare regime? The first step is obviously cleansers. We'll be talking in depth about all these steps in a later slide, but I'll just brief it up quickly here. Cleansers are basically soaps which do not make your skin feel too dry, but at the same time remove the dirt and the oil adequately. For an acne prone skin, salicylic acid and glycolic acid is a good choice. Whereas if you have a sensitive skin or dry skin, then gentle cleansing lotions without these exfoliating acids is the way to go. Next step is serums, or if you are a fan of toners, then yes, next step is toners. Serums in the morning, the best serum is vitamin C or resveratrol or ferulic acid. The basic purpose of these serums is to protect your skin from the environmental damage that you're going to face throughout the day. So the sun rays, the pollution, the environmental stressor, this vitamin C and all these serums basically protect you from that damage so that your skin does not become dull and does not age faster. Next, you can also use a toner. Few people are really keen about that. Although dermatologists don't really recommend toners nowadays. Toners were used back in olden days when the soap used to have a lot of lye. So they used to disturb the pH balance of the skin. Now, since the cleansers are more advanced and they do not leave behind residues, toners are not basically necessary. If you have to use a toner, then use a toner which has either glycolic acid or hyaluronic acid. A hyaluronic acid toner would make your skin moisturized, whereas a glycolic acid toner would give it a good exfoliation. So this acts as an exfoliator more than as a toner. The next step is obviously moisturizing. Dry skin people need to use a creamy and a thick moisture based lotion, and whereas a person with oily skin should go for a water based gel preparation, especially with summers now approaching. The last step is sunscreen. Without saying, this is the most important step in your skincare routine. You have to use sunscreen 365 days in a year, whether you're at home, whether you're going out or not. And the sunscreen should be at least SPF 30. In the summers, you can even go for SPF as high as 50. I'll come to it again in detail. So what about the night care regime? Night care regime starts with cleansing. Double cleanse is the way to go if you use too much makeup. The first layer has to be an oil-based cleanser, which removes the makeup, the sebum, the dirt accumulated through the day. And then the next step, you can use the same cleanser which you used for your morning care routine, which is just a water-based cleanser which removes everything. Once your skin is clean, now you come to spot treatments. For example, if you have acne, you apply medicines of acne right after cleansing. If you have dark circles, use the under eye creams below your eye. And if you have melasma or other problems of patchy pigmentation, then you can dab on this cream before you do any other steps. Now, if your skin is too dry, then you can moisturize again using the same moisturizer as you used in the morning. The nighttime serums can be slightly different from what you use in morning, because these serums then now need to repair. They need to start repairing the damage which has been done throughout the day. And a good ingredient would be azelaic acid if you have dull, dry, and lusterless skin, or hyaluronic acid, which will make it moist. Next step is obviously retinoids. I probably most of you have heard of it already. Retino A 0.025% is one of the most famous brand, and a lot of people use it. But you have to be very cautious with the way you use your retinoids. It has to be used under dermatological supervision. Do not overuse this because it can also harm you. Also, a word of caution around retinoids, that it is strictly prohibited if you are pregnant, about to conceive, or if you're breastfeeding your child. But overall, retinoids is like a blessing in dermatology. It helps with myriad of indications such as pigmentation, acne scars, blackheads, seborrhea, everything. So it is my favorite go-to night care drug. Now, in depth about cleansing. So washing your face is the most basic and essential step. Our skin comes in contact with environmental pollution, dirt, and other factors throughout the day, which need to be gently removed. So you have to wash your face twice daily, at least morning and night, to avoid clogged pores, dullness, and acne. But make sure that if your skin is oily, do not overwash it, because then there is a rebound oil production, which is not good for you. And then you have to find the right cleanser. How do you know whether the cleanser is right for you or not? Is once you wash it, you should feel that your skin should not feel very, very tight after you wash it off. And the cleanser should not strip off the essential and healthy oils. And you have to be very minimalistic with using exfoliating scrubs. Do not scrub for more than once a week, because over scrubbing tends to make your fine lines appear sooner and quickly. So stay away from scrubbers just once in a week, and preferably chemical exfoliation over physical exfoliation. So this is a brief chart on how to choose your cleanser. If you have oily or acne prone skin, then go for a foaming liquid. When activated with water or pumped into your plant, the cleanser morphs into an airy form, and it helps to break the excess oil, which is the case with acne prone or the oily skin. If your skin is eczema prone, it is sensitive, red, or dry, then you should go for a cream or a lotion based cleanser, which will not strip off the moisture. It will retain the moisture, and while it removes the dirt, it will hydrate the skin simultaneously. For sensitive skin, oil based cleansers are good to go. And the current favorite is micellar water. It is a staple of French routine. And this is a soap free option which does not make your skin dry, but at the same time, it removes the dirt like a magnet. So, when we opt for double cleansing, the step one can be micellar water, and step two can be your other type of cleansers mentioned above. Coming to the next step, which is serums. Again, lot of you must have heard about the vitamin C serum, hyaluronic acid serum, retinoid serums. So what are serums? What are they basically? Serums are nothing but concentrated doses of active ingredients. They are very watery to touch, and they are very quickly absorbed. So they should be the first layer that you apply after washing your face, so they are absorbed in its maximum capacity. And now, how do you choose your serum? So there are various, as I told you, there are various serums available: hyaluronic acid, vitamin C, retinol, vitamin B3, sulfur, niacinamide. Hyaluronic acid works best for dry skin, and it helps in sealing hydration, strengthening the barrier function to prevent moisture loss. Vitamin C helps in brightening the dull skin, and vitamin C is a very potent antioxidant. It prevents your skin throughout the day from the sun damage, the pollution, and everything else, to make your skin more even toned, and decreases the dark spots, decreases the patchy pigmentation, and moves your skin towards the smooth, even, and flawless type of look. Next is retinol, vitamin B3, and peptide serums, which stimulate collagen, and they promote collagen and elastin synthesis. Proteins in the body. These are proteins in the body that prevent lines and skin sagging. So, in short, they are good anti-aging molecules. Colloidal sulfur and niacinamide are basically, they should be used by people who have acne. They help in calming down the redness and irritation, and also decrease the inflammation. They improve acne with a minimal antimicrobial effect as well. The next in line is moisturizers. The most basic function of a moisturizer is to hydrate and soften the skin. Now, the choosing the right moisturizer according to your skin type is very, very important. If you, for example, if you have acne prone skin or oily skin and you use a very thick cream based moisturizer, you can have more breakouts. So it's important to know your skin type and then choose the moisturizer according to that. For example, there is a very common myth that people with oily skin do not need moisturizer. That's completely wrong. With people with oily skin need a watery based, a gel based moisturizer, but definitely they do need a moisturizer because this prevents fine lines from happening and keeps your skin hydrated, prevents it from looking dull. So oily people can go for a gel based moisturizer. This is basically a water based option, very lightweight and absorbs quickly. If you have normal or combination skin, then you can go for a lotion, which is slightly more hydrating than gel, but lesser than the cream form. The dry skin people should definitely go for cream and soft cream bases. They're more oil based and they're slightly more heavier than the lotion form. People with inflamed skin and sensitive skin, or people having problems such as psoriasis, atopic eczema, they should go for thick heavy balms, but make sure your skin is not acne prone, otherwise you will break out like crazy with these. So they are basically, balms are meant for people with problem skin. Next is sunscreens. Sunscreens, I can speak for 45 minutes just on sunscreens. It's that important a step. You need to start using sunscreen. If you're not using one, then start using it from today. Now, how do we classify sunscreens? There are two types of sunscreens, chemical and physical. So it's basically the difference in the ingredients between the two and also the mechanism by which they act. For example, chemical sunscreen gets absorbed into your skin to counteract the damage from UV. So chemical sunscreens have to be the probably the second layer. Like once you wash your face, you apply a serum and then you do a chemical sunscreen so that it actually goes inside your skin, forms a good barrier and prevents the UV rays from coming in. Chemical, how do you recognize a chemical sunscreen in the market is that if you read the ingredients, if your sunscreen has oxybenzone or octinoxate, then it is a chemical sunscreen. Now, physical sunscreens are an entire new generation of sunscreens coming in trend for the last 2-3 years. Their common ingredient is titanium dioxide and zinc oxide. So these are basically small salts which form a covering over the skin. So this type of sunscreen does not enter inside, it forms a layer over the skin. They sit on the top of your skin to deflect the UV rays which are coming. So people with sort of eczema, atopic dermatitis, or even in children who are younger than 12 or 14 years, when your skin barrier is not that bulletproof, then you should go for a physical sunscreen because there are lesser chances of allergy with this. So earlier what used to happen was that physical sunscreens were not that cosmetically appealing. They used to leave behind a white cast. But today the newer generation physical sunscreens are amazingly formulated. They give you a very good tinting effect, and also they give you this shineless matte sort of look. So physical sunscreens are my current favorite, and you can recognize a physical sunscreen in the market by checking on the ingredients, which are titanium dioxide and zinc oxide. So what is the way to apply sunscreen? A sunscreen should be applied 30 minutes before the sun exposure. This is very, very important. Has to be applied 30 minutes before the exposure, and you have to reapply the sunscreen at least every 2 hours. So make sure that you carry a sunscreen in your bag, and if you're outdoors, then reapply it. So why do we have to take this gap 30 minutes? Is because, as I told you, these sunscreens need to be activated. They need to form a barrier before they actually become effective. So if you just smear on a sunscreen and you step out, then it's not going to help you. You have to make sure that it is 30 minutes before. Now, physical sunscreens on the other side can be, they don't need 30 minutes. They just form a barrier. If you use enough amount, then physical sunscreens में this duration is a bit shorter. The next very, very important point is how much sunscreen is actually required. So if you see my finger, this is one fingertip unit. You need at least one entire finger amount of sunscreen for just your face, which is approximately 1/4 of a teaspoon. If you're not using the sunscreen appropriate amount, then the sunscreen is not giving you 100% protection. It is falling short of that. So you make sure that you apply the sunscreen generously. You will have to merge it properly, and you make sure that this is used in the correct amount. About 2 tablespoons of sunscreens are appropriate to cover your face and exposed areas of the body, which is your arms, your neck, and your feet. And do not forget to apply sunscreen on your neck area, your décolletage, your hair, so the your ears, because these are the areas which start showing aging after 35, 40, because you take care of your face, but these areas are frequently skipped. Next, just basic rule of thumb that we have to take care of while we are making a skincare regime is that always apply the thinnest to the thickest layer for better absorption. Meaning serums first, because they're the thinnest of the products and they need maximum absorption. So after cleansing, it should be your serum, then your spot treatments for your acne, for your under eye pigmentation, or your melasma patches. Then comes your moisturizer, and last is the sunscreen or your retinoids. If you have any major problem, for example acne or patchy pigmentation, then treat that first. After cleansing, use products which specifically treat those areas, so that those areas are that concern is properly targeted, and you can get relief of those things in timely manner. Now, how do you layer your products? Always wait for 2 to 3 minutes before applying on the next layer. Give it 2 3 minutes to for it to get absorbed, and for it to start working, and then you can go ahead and do the next layer. The next thing is, with the skincare regime, always give your products some time. The skincare, good skin is not obtained overnight. It needs some time to actually start showing results. For example, retinoids work at your genetic level. They improve the skin proliferation, they improve the skin turnover, and they help in removing the dead skin cells. But that effect starts happening after a few weeks. So do not be impatient. Do not label a product useless unless and until you have used it at least for 6 weeks, both morning and evening. And another thing is that do not keep frequently buying or changing new products. Give products some time, see how they work, and then add on new products. If you purchase, if you keep changing or shuffling between your products too soon, then you won't realize its full benefits. And also the other thing is that some products might not suit you, and if you start using too many products in one go, you will not be able to figure out which product is giving you allergy or which product is causing more damage. So always, before starting a new care regime, always add the next step after a week. Just use one product for a week, see whether it suits your skin type, see whether it is not giving you any acne or any rashes, and then go ahead and buy the next product. So here we are done with the skincare. And no, so one more slide. In clinic procedures for skin glow, this is the most famous, most asked for procedure in the hospital. At Max Panchsheel, we offer you various type of procedures to make your skin healthy, make it glowing, and also to give you that shine that you're looking for. I'll just briefly walk you through them. Chemical peels, as you must have heard of, is a simple procedure in which we wash your face, cleanse it properly, then apply a small amount of liquid depending upon your concern. If it's acne, we use salicylic acid. If it's tanning, we use retinol. If it's glow, then we use glycolic acid. So we have a lot of chemical peel options in the clinic available, and according to your skin type, your concern, we apply this, leave it for some fixed duration, 5 minutes to overnight for retinol, then simply wash it off. So this is a very good maintenance therapy. It removes the dead skin cells, gives a very good glow to your face. So, and with zero downtime. So you can come in any day, get it done, and you'll be free in half an hour. The other very famous procedure is vampire facial, also known as platelet-rich plasma. It has been popularized by the famous Kim Kardashian, and you can see the picture on the left side where a vampire facial has been done. So why the interesting name? In this procedure, we take out your blood sample, centrifuge it, collect all the growth factors, and then re-inject it on your face. We can do it in two ways. Either we use small syringes to inject all over, or we can micro needle it, as seen in this picture. So the benefits of this is that we're collecting all the growth factors and we're injecting it directly in the skin. The basic behind is, if you get hurt, that injury site heals in 7 to 8 days. How does that happen? Your body sends signals which help in rehealing, in healing, and skin rejuvenation at that particular site. So we are exploiting that very idea. We are concentrating the growth factors, and we are making fooling your body into believing that you're hurt on the face. It sends in a lot of growth factors in response, and you end up getting very good collagen boosting, skin lifting, and glow. Next treatment is Revlite laser toning. This one on the bottommost corner, where this is famously known as the Hollywood peel. Here, a charcoal layer is applied on the face, and then with the laser shots, this charcoal is removed. Why this helps is that the charcoal actually goes into your oil glands, and when we give the laser shot, the charcoal comes out, but it also brings along the oil, so that your oil glands become totally clean. And therefore this procedure helps with your acne. It helps to reduce your the oily skin texture, and ends up giving you a very good glow. So Revlite is a very frequently asked for procedure in the clinic. Fractional surfacing, laser surfacing, is mostly done for people who have open pores, or they have scars, pits from their previous acne, or their skin is not even. It has small textural differences here and there. Fractional, so this laser needs to be done once or twice in a year, and it basically removes all the top slough, and you get a completely new skin from below. So this skin is free from photo damage, it is free from scars, and overall your skin starts looking smoother. All these procedures can also be done on the body, by the way. If you have similar concerns of the body, they can be repeated there. The last is obviously Botox and fillers. So I'm an expert cosmetic injector. If you are bothered by your frown lines, your glabellar lines, or your crow's feet, then Botox is the answer for you. Botox is basically just nothing but a purified protein. So how it helps is that it neutralizes it, relaxes your muscles here. So those muscles which are responsible for the frown lines or your forehead lines, those muscles are relaxed, and it ends up giving, opening your eyes better, and taking away that tired or sad look away from you. So nothing to be afraid of. If you have any queries regarding any of these procedures, then you can obviously contact me. Now moving to hair care basics. The hair care basics, hair is like hair type. We first, again, like skin, we need to know what our hair care, what is our hair type. And it could be fine, thick, or coarse, depending upon the thickness of the diameter of the hair shaft. Also, there is another way to distribute your hair into straight, wavy, or curly type. It's important to know your hair type, because then you choose your shampoos and your conditioner according to the type that you have. The fourth type that I like to consider is chemically treated hair. Like if you're a person who used to get a lot of this hair care treatments like keratin treatment, bleaching, bonding, then your hair shafts become very, very fragile, and they need an extra precaution, extra nourishment in the form of conditioners or hair masks. So chemically treated hair is a separate entity which needs to be dealt with more delicately. Just to go through the basic hair care do's and don'ts, you should always shampoo your scalp and condition the strands. So what happens is that this is the area which is a house for dirt. It has all the oil, all the dirt, the pollution, everything. So make sure that whenever you're washing your hair, then you wash your scalp properly. The strands, on the other hand, they do not hold dirt as much, and they have a tendency to get dry. So make sure that you do not use shampoo hair. You condition this properly, and you shampoo the scalp skin. The other thing is that if you have fine hair like mine, then you need to wash your hair more frequently. What happens is that all the oil and the dirt that collects on the scalp tends to make your hair limp, and this adds to the weight and makes your hair, the fall is not that gracious. So if you have fine hair, then wash your hair ever so frequently. The other question that I'm asked is like, how frequently should I wash my hair? There is no correct or wrong answer to it. It all depends upon what your need is. If you are a gym person, then probably you might need to wash your hair every day. On the other hand, if your scalp is dry, then washing even twice or even once a week is good enough. So see whatever works for you, see what works for you best, and which does what does not damage your hair. But the ideal amount is 2 to 3 times in a week. After washing your hair, do not do not rub it badly. Just dab dry with the towel, and do not let it to be air dry. Air drying is also not very healthy. Try to just soak all the moisture. The other thing is that your hair is the weakest when it is weak, when it is wet. So do not try to style, or do not try to detangle it when it is wet. Just let it dry up a bit, and then you can go ahead and style it, or probably detangle it. Use shampoo formulated for your hair type. As I said, that you should know whether your hair are fine, coarse, or thick, and also whether your hair are curly or straight or wavy. Then do not pull your hair too tight. If you are, fan of high ponytails, then you tend to end up losing your hair faster. Do not pull the hair too tightly from the roots. Then there is this entity is known as traction alopecia. Over the period of time, when you continuously style your hair in a very tight ponytail, then your hair starts to the root starts to become weaker. So ever so frequently go with open hair, or tie a loose messy bun, whatever suits your face, or whatever your personal choice is. Then next is avoid excessive use of hairstyling. If you are a person who likes to blow dry and use straightener every day, I would rather advise that you go for a keratin treatment. Do not use hairstyling products which use heat every day. And always try to use a hair protectant spray before styling, so that the heat damage is minimized. Last is, people with dried hair are advised not to wash it every day to prevent premature color fading. If you have colored hair, do not try to increase the duration between your washes, so that the hair color lasts longer. So this is the basic behind hair care and skincare. I thank you for listening to me patiently. And if you have any more queries, you can always reach out to me. This is my WhatsApp number, my Instagram handle, and also you can mail me on this Gmail address.
Hi guys. So you can ask now questions. So ma'am, we are receiving question from Pooja.
Okay,
How
hi.
to treat how to treat hormonal acne without oral medicines?
Oh, hi Pooja. So that's a very important question that you asked. Hormonal acne is a very difficult thing to treat. And for example, if a patient of PCOS comes to me, then my first and the foremost guideline is to make a lifestyle modification. You have to start by losing weight. You have to start by having a good diet. You If you're asking me about the non-medicinal ways to treat it, then there is no cure as such. But then we can keep the acne under check. We can keep your hormones under balance by giving you a good lifestyle, and by seeing what you eat. If you eat too much processed food, sugar, dairy, then they can precipitate your acne and make them worse. So all try to go for vegan diet, try to avoid dairy, try to avoid sugars. But at the end of the day, if it's not being controlled by these lifestyle modifications, then I would advise that you do not shy away from taking medicines. There is no harm in them. Take it under proper doctor supervision till your hormones come back into check, and then you can stop them. Guneet? 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 Guneet?
Hi,
Puneet, can you hear me now?
yes, ma'am. Yes, ma'am.
Okay, I lost you in between.
So, guys, we are having question from other platform as well. So, ma'am, the question is reason for frequent acne.
Acne. Okay. So very interestingly, I've shared a post on the same on my Instagram page. Acne is not just blemishes that you see. What happens is that our oil glands are hormones itself. And very common cause of acne is inflammation happening in this entire area, in the distribution where your oil glands are present. Now, what happens is that there is inflammation, there is excess oil production, there is bacterial proliferation at the local site all, and there is also retention of the dead skin cells in your oil glands. This all leads to blocking of your pores. Once the pores are blocked, the oil is not able to come out, and it bursts inside your skin to cause local inflammation, which you see as acne. Now acne again can be seen as whiteheads, blackheads, nodules, cysts, papules. So this depends upon the underlying inflammation that you have. You should definitely sit with your dermatologist and try to understand why your acne is happening again and again. So that will make you be more compliant with the treatment, and once you understand the condition, you'll not be frustrated by it.
Uh, Devendra Bansal is asking, how can I fix uneven skin tone?
Yes. So, Devinder, as I mentioned in my PPT, numerous things. The first thing that you have to do is start using a sunscreen. I don't know whether you using one or not. That's the first number one. And depending upon the age, upon your skin type, you can start using retinoids. You can also come in for procedures such as chemical peels and these lasers. But also make your diet better. Try to drink more water. Try to have green leafy vegetables and avoid sugars.
So, the next question is it good to use shampoo daily? Because I have really oily hair. So, if I do not use shampoo someday, the hair looks really oily and greasy.
Yes. So yes, you can use your shampoo every day, but the shampoo that you use has to be, has to be prescribed properly. Like you should not use a shampoo which is very, very harsh on daily basis, because that will strip your hair with the moisture of the moisture. So use a gentle shampoo, a very basic mild shampoo on a daily basis. That's okay.
The next question is how to treat hair fall cause of hard water.
Hard water. Okay. So hard water, lot of people when they move to Bangalore, Pune, they tell me the water is not suiting me, and I've suddenly have started getting a lot of hair loss. One expensive solution is to use Bisleri or RO water if it's too harsh there. But then also I would suggest you that you check your nutritional status, your vitamin B12 levels, your vitamin D levels, and rule out any nutritional cause of hair loss. So check out the nutritional causes and then change the water type. Try using distillery water or RO water for few washes and see if that makes a difference.
The next question is what to do for burning skins in summer.
Burning skin. So I'm not sure I'm getting the question properly. Are you talking about sunburn or tan? In any case, the answer is using a sunscreen properly. If you're going out on a beach or if you live in a place where there is a lot of direct sun rays, try wearing a wide brimmed hat, which prevents the sun rays directly from falling on your face. Try to wear loose cotton clothes, preferably lighter in shades, white or something like that, and keep your body covered. And if you're talking about sunburn, then yes, you need to see a doctor and to know, the medicines if in case you need it. But go with sunscreens. That'll help you. And you can also carry an umbrella.
Uh, the next question is loss of hair at age of 25. What can be done to stop?
So do you know the name of the person? Is it a male or a female?
Male, male.
Okay. So mostly males suffering of hair loss at the age of 25 is mostly male pattern baldness, and that is due to a hormone known as testosterone, which is the male hormone. And this needs proper medication. Probably you've heard of minoxidil treatments like PRP, derma roller. But then treating male pattern baldness is a continuous process. You need to start using some medicines and need to act fast if testosterone is the cause, because it's a progressive irreversible cause of hair loss. Whatever hair you lose are not going to come back with medications itself. So act soon. First of all, get to the diagnosis, get the correct diagnosis, whether it is hormone based or is it nutritional, and then start the treatment soon. That would be my advice.
Okay. So guys, we are receiving question from another platform as well. So do subscribe Helcom YouTube channel. Okay. So ma'am, next question is, what can be done for regular hairs on faces?
Okay, so for hair on the face, best is laser hair reduction. Totally safe and very, very convenient. Once you're done with the laser sittings, you do not get your hair growth back. If you do not want to go that way, then you can shave your hair, and you can also go for the basic threading and those salon procedures. Try to avoid using wax because it's too harsh, and also bleach. So you can just, shave at home, or you can come into the clinic for a laser hair reduction. And one more important point, rule out that you do not have any PCOS. If you're a female patient, if you're getting hair in the beard like distribution, the chin, the jawline, then it can be hirsutism. It can be due to the male hormone. Get yourself checked.
What can be done for regular hairs on faces in females?
Yeah, that's what I told about right now. So lasers and shaving, threading, ruling out hormonal cause of hair growth.
The next question is dandruff a serious problem and how can I get rid of a dandruff permanently?
Again, there is no permanent cure to dandruff, and it's not a problem as such. For example, if you're born with oily skin, so is your scalp tendency to have dandruff. So do not stop looking for a permanent cure. And very simple solution to it, you can just use an antifungal shampoo every time you wash your hair. First wash your scalp with a regular shampoo, and then use an anti-dandruff shampoo which has ketoconazole. Let the ketoconazole sit on your scalp for at least 2 to 3 minutes so that it has time to act, then just wash off. This alone is enough to control the mild dandruff. If you have more severe dandruff, which is known as seborrheic dermatitis, then you need to see a doctor who will guide you better. Meanwhile, also make your diet nutrient rich, because dandruff is can be caused by a fungal element, Malassezia furfur. And when your immunity dips down, that fungus starts overproducing the dandruff lesions. So make sure that you're eating healthy, and apart from that, just keep using a ketoconazole shampoo and you're good to go.
Yeah, so we are getting question from YouTube channel, that is, why do my fingers get small cuts and itchy too? What is the treatment for this?
Small cuts. So probably I'll have to see you in the clinic, because what type of cuts you're talking about, there are many reasons. If you do a lot of household works, if you are exposed to chemicals, if you are a painter, if you work with chemicals like dyes and stuff, and also if you are a cook, for example chef, so then you're exposed to the chemicals in the fruits and vegetables. We need to get to the cause behind the cuts, and then treat it with antibiotic creams.
Okay. So the next question is, do skin allergies cure?
Yes. So skin allergies, if we remove the allergen, then yes, there is a cure. And allergy is a very vague, broad term. There is no single answer to this question. We have to get to the bottom, the cause of the allergy. For example, if the allergy is due to your hair dye, once you stop using the hair dye, the allergy gets better. But if the allergy is endogenous, for example, if you're getting allergy to something, a reason which you cannot remove, then it is slightly more difficult to cure. So getting to the baseline, to the reason behind allergies, is very, very important. But essentially, if it's due to an external factor, then once we remove the precipitating factor, the aggravating cause, your allergies start to get better.
Yeah. So, ma'am, I have one question that I have a skin allergy. I get itchy and it's turned into a big rashes. And even if I get a normal itchiness, then too it's turned into rashes. What
Okay.
causes this and what should I do?
So I will have to see you again because your pictures are not in front of me. There are thousands of reasons behind a rash, but a simple thing, an SOS thing that you can do at home is take an antihistaminic. But it's better to consult a dermatologist and get your rash checked. What might appear very simple and very easy to you might be something else, and it's better not to self medicate. It's always better in case of rashes. It's better to get yourself checked.
Okay. Thank you, ma'am.
Okay.
The next question is, my skin is very sensitive. If I do face facial, then the heat comes out of my face and redness also. What should I do to get rid of it?
Yeah. So the heat that you feel, what happens is that when your skin is sensitive, when we do too much procedures, too much massaging, or we use products which are not suiting our skin type, then the blood vessels there just dilate. The blood flow to your face increases to help in healing the skin which is damaged. That's why you feel the heat, and that's why your skin gets red. But sensitive skin, we have to tread very, very carefully. Do not try. It's better to stay away from facials. Let the sensitivity come back. Strengthen your skin with a good moisturizer. Use a sunscreen and stop using every other product till you feel that your skin has come back to its normal level. And then go ahead with the procedures or facials, whatever you're doing. But meanwhile, it's sensitive. Do not play around and be very, very cautious.
Okay. So the next question is, I work on the laptop and because of stress, I get dark circles under eyes and sometimes itching to get rid of it.
So, over the past 1 year, we all have been on our laptops and phones much more, and it's led to a different kind of problems. The under eye problem is a very common thing which I'm seeing in the clinics nowadays. The only way is to make your sleep cycle better, sleep on time, wake up on time. Do not have salt after 7 p.m. because the salt tends to retain water under your eyes, and then your eyes start looking puffy and tired. Do not have water enough quantities, around 2.5 liters for females and around 3.5 liters for males, so that this under eye skin is hydrated. Try to use your glasses if you have a vision defect, because otherwise there's too much strain on the eyes. Then you can come in for procedures such as fillers and botox, which can be, fillers are injected right below your eyes, and the hollowness improves your eyes, end up looking brighter and fresher. And lastly, avoid too much screen time if you can do that. Unnecessarily do not keep picking up your phone, do not keep looking at the screen. After every 5-15 minutes, try to shut down your eyes, close your eyes, rest for a minute, breathe deep. And there is this eye drops, methyl cellulose. You can frequently keep using it so that the tear film is restored and your eyes do not feel dry. But in any case, do not rub, because the skin is very sensitive. When you rub, you end up getting fine lines and dark circles. So stay away from rubbing.
The email console is asking, is it only a hair growth solution available in market on dry scalp?
What? Can you repeat the question?
Yes, ma'am. Is it better to apply a hair growth solution available in market on dry scalp?
So I do not understand which is your chief concern, hair growth or dry scalp. If your concern is hair growth, do not buy any serum which is available. Go for growth factors such as Capexil, Proanogen, then Capcane. There are various growth factors available. Do proper research before you buy a growth factor serum. But the growth factor serum per se would not help you with the dry scalp. The dryness is happening on the scalp, and it can you can use coconut oil half an hour before you wash your uh, wash your hair, before you shampoo, so that the skin of the scalp is moisturized. And apart from that, minoxidil is one of the reasons which give rise to dryness. So if you're using that, probably you can shift and you can consult your doctor to find an alternative.
Okay. So next question is, I am having too much hair fall problem.
So too much hair loss, I think everyone is suffering from hair loss. The very common causes of hair loss is nutritional deficiency, vitamin B12, vitamin D3, and iron levels. Then also thyroid abnormalities, if any, can lead to hair loss. First and foremost, make sure that you're not suffering from any of these. This takes part of the nutritional part of hair loss. Then if you have hormonal, that's a different story altogether, has to be treated in a different way. And if you have had, COVID or typhoid or any other illness in the last 6 months, even that can give rise to hair loss known as telogen effluvium. Usually this type of hair loss recovers on its own, like you don't have to do much about it, because there is when there is stress to the body, it hits your hair as well, and you end up losing hair probably 3 to 6 months after the trauma has happened. So getting to the cause of the hair loss is important. There is also another entity known as alopecia areata, where you see big patches of hair loss. Like there is patches of hair loss all across your scalp, in your beard areas, your eyebrows. So that's a different medical entity and needs different sort of attention. So get to the cause of the hair loss. That's the bottom line.
So I guess there is no more questions.
Okay. Okay, Gurneet.
Thanks, Dr. Veenu Jindal, for enlightening us about hair and skincare. It was a very wonderful session and very, very informative. And
Thank
I
you.
hope people who have joined with us, they have got benefit from the webinars. Thanks for giving us your precious time.
Thank you, Gurneet.
Thank you, ma'am.